Children often get rashes, and they can be from all sorts of causes. Things like infections, allergies, or skin conditions like eczema. The most common cause of a rash in a child is an infection, and of them, viruses are the most common. It's very common for kids to get a small, bumpy pink rash all over their body that may come and go and move around. The rash disappears when you press on it. Sometimes they get the rash at the start of the viral illness, and with other viruses, the rash comes up at the very end, after the fevers have disappeared and the child starts to get better. And these are all really harmless rashes that come along with the virus. Other viruses can cause more irritating rashes, like the hand, foot and mouth rash that's blistery on the hand, feet or mouth, the measles rash that's red and blotchy all over the body, the chickenpox rash which is very pimply and blister-like with fluid that can be very contagious. The next type of rash to talk about is hives. So that's the raised bumpy rash that we often see with allergy. What many parents don't know is that viruses can also cause hives as well. These can be really itchy spots, but antihistamines tend to help a lot. The important thing with hives is to think about whether there could be a trigger. Could it be food related or related to pet hair, for example, or medication, or could it be that the child has a virus? It's a good idea to see a GP once your child has had a hives rash. The other rash that we see a lot of that can often bring children into hospital is eczema. Eczema is when there's an issue with the skin barrier and the moisture in the skin barrier. The main triggers for eczema, things like overheating, particularly in winter when it's really cold and children are wearing lots of layers and there's a lot of heating on, irritation from other products, so such as creams and bath washes, and food can trigger eczema as well. Eczema can also become infected, particularly if the children are scratching the eczema spots. Bacteria from their skin can go into the eczema and can cause infection over the eczema, which can be really quite painful. The main thing with eczema is to, 1, avoid the triggers. So if you know that overheating or certain foods trigger it, avoid them until the skin is under control. Number 2, which is probably for me the most important, is to moisturise. Moisturise with a good thick cream twice a day if you can, but ideally after a bath. Oil in the bath can be really helpful as well to keep in that extra layer of moisture. Helping to control the itch, so keeping the nails nice and short and keeping the skin nice and moist can help control itch. Your GP can chat to you about wet dressings as well, which can be quite helpful. And there are other treatments such as steroid medications or bleach baths or antibiotics that can be very helpful for eczema. A GP is a great resource for eczema management. Otherwise, there are some fantastic websites listed below that can be really helpful for parents who are trying to manage eczema. With the rashes, they can look quite concerning, and if you're worried, always make sure you seek help. The main rash that we would be concerned about is a dark red rash that doesn't disappear when you press it. Particularly if your child is unwell or has a fever, with that rash, we would recommend seeking urgent help. Apart from that, for any rash that you're concerned about, you should see a doctor either at the start, if it continues longer than expected, or if anything changes.